This is Lenape Valley's board of directors. Now, one of the more interesting people on this board of directors, there's a couple that are pretty interesting, but is this gentleman, Michael Wolf, retired National Policy and Advocacy Director for Mental Health, Johnson & Johnson, the pharmaceutical company. Now, a lot of people probably know this already, but what happens is when people quote-unquote retire from the drug companies, a lot of times they become lobbyists. So essentially what's going on here in theory, I don't know this for a fact, but as retired drug policymakers and things like that act as lobbyists for congressmen and people like that, and lobbyists for things like that, they also like to get their hands involved in not-for-profits like Lenape Valley, especially not-for-profits that basically have the ability to prescribe their products to people, to, American citizens. So this is about Johnson & Johnson innovating to improve mental health across the globe. Of course, out of the kindness of their hearts, not because they're getting profit from it. Okay, so this is, according to statistics, blah, blah, blah. You can read this on your own. My point is that it seems to be a little fishy that somebody that used to work for Johnson & Johnson is sitting on the board of a not-for-profit that prescribes pharmaceutical drugs to people. Some of those pharmaceutical drugs are made by the company that the person used to work for. Moving on. So Johnson & Johnson Pharmaceutical Research and Development is headquartered in New Jersey, blah, 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 approximately 3,500 drug evaluation. Company's major therapeutic areas include hematology, oncology, infectious disease, obesity, metabolic. Now wait, keep this in mind. So, therapeutic areas include hematology, oncology, many psychiatric medications can cause cancer, infectious diseases, obesity, many psychiatric medications cause obesity, metabolic disorders, many psychiatric medications cause metabolic disorders, neurology, many psychiatric medications disrupt the neurology and cause things like autonomic dysfunction. Psychiatry, which is literally what Lenape Valley deals in there, is psychiatry, prescribing pharmaceuticals to patients and women's health. Oh, and pain management, I'm sorry. So moving on. Johnson & Johnson. Okay, so Johnson & Johnson claims that this drug that they're coming up with, this shot, will keep you out of prison. You can read this on your own. I'm not going to get into it. People probably know this if they know anything about the history of psychiatry. There were a lot of promises made by psychiatry, okay? And the functioning of psychiatric patients has gotten worse and worse and worse and worse and worse. And, the idea that you could just empty the institutions and all that, no, that didn't happen. The idea that, you can give people a pill and they wouldn't need talk therapy didn't happen. The idea that you could treat psychiatric issues like you would an infection didn't pan out in real life, did it? So let's move on. Now, before I continue, I want to remind people I'm not a doctor. I'm not an MD. I'm not a DO. I'm not an ND. I'm not a chiropractor. I'm nothing like that. This is a story from CBS. You can watch it on your own if you want. I'm also not a nurse. I'm not a nurse practitioner, not an LPN, not a CNA, not an RN, nothing like that, not a nutritionist, not a dietitian. I'm nothing. I'm not a chiropractor. I think I already said that, but the point is I'm just a guy on YouTube. This video does not constitute any type of medical advice, okay? So this is about how drug companies turned to lobbying amid state opioid lawsuits. Now, what you need to understand about this is this. Okay, the opioid crisis was caused by lobbying. Okay, more or less, because it made the DEA not crack down like they should have on things. Now, what you have to understand is, what the problem is we have had not a pandemic or an epidemic of psychiatric illness. We have had an epidemic of psychiatry, an epidemic of psychotropic overprescription, an epidemic of pathologizing behavior. And a lot of the side effects of these psychiatric medications are psychiatric symptoms. The FDA put a black box warning on antidepressants because of how literally dangerous they are. So the black box warning is the most severe warning the FDA can place on a drug short of an outright ban. The bold-faced text appears at the beginning of the package insert accompanying each prescription, warning that antidepressant usage for children and adolescents may increase the risk of suicidality. It also indicates that the exceptions of these drugs here is obsessive-compulsive disorder. Antidepressants are not approved for pediatric patients. Keep that in mind. Antidepressants are not approved for pediatric patients. I, however, was on antidepressants as a youth. So what are the side effects of antipsychotic medications? Well, you have bedwetting, blood disorders. Remember, Johnson & Johnson works with part of their thing is hematological issues. So blood disorders, body temperature problems, metabolic issues, emotional effects, psychiatric issues, eye problems, heart problems, cardiac issues, liver problems, metabolic syndrome, metabolic issues, neuroleptic malignant syndrome, neuromuscular side effects, sedation, seizures, sexual and hormonal problems, which of course cause hormonal problems cause every kind of problem, but definitely metabolic problems, definitely mood problems, definitely other things like that. Skin problems, suicidal feelings and behavior, tardive dyskinesia, tardive psychosis, it causes psychosis, weight gain. Okay, it can cause blurred vision, confusion, agitation, constipation, difficulty urinating, drowsiness, dry mouth, erectile dysfunction, hallucinations, hot or dry skin and decreased sweating, increased pressure in the eye, low blood pressure, nausea, rapid heartbeat, and disturbed heart rhythm. Now, what's funny about this, I have something called autonomic dysfunction, which my cardiologist believes was due to the very high dose of Seroquel I was put on, which is why I now require a very low dose of another serotonin reuptake inhibitor to stay normal, because my nervous system has been shot to shit by antipsychotic drugs. Was I given an antipsychotic drug because I was psychotic? No, I was given an antipsychotic drug for major depressive disorder because for some reason the psychiatrist that I saw in an inpatient facility thought, oh, well, it's an antipsychotic, it might work for major depressive issue too. Okay. Bedwetting. Bedwetting can be a side effect of antipsychotics. It is more common with some antipsychotics than others. Imagine that, just, oh, well, I pissed the bed, wonder why. Blood disorders, agranulocytosis, blood clotting disorders, reduced white blood cells, so it causes immune issues also. So this is a granulocytosis is a blood disorder which involves a loss of one type of white blood cells, which are granulocytes. Okay. If you have the following symptoms, it may be a sign that your immune system is not working as well as it should be. Sore throats, mouth ulcers, and fever or chills. I had severe mouth ulcers when I was on the different psychiatric medications. And I'm going to get into this because a lot of this has to do with a combination of nutrient deficiencies and things of that nature. And I'm going to talk about potential orthomolecular things that might help. Blood clotting disorders. These include deep vein thrombosis, which could very well kill you. Reduced white blood cells. Taking antipsychotics may cause a reduction in white blood cell count. Body temperature problems. Antipsychotics can cause problems with regulating your body temperature. It may become too high or too low, both of which can make you feel unwell. Also can be extremely dangerous if you're into outdoor sports or any type of outdoor things, or even just athleticism entirely. When I was a teenager, I passed out in a karate class. I was teaching a karate class, and I passed out during the karate class due to a whole host of issues that were traced to the antipsychotic I was on. Or not antipsychotic. It was a mood stabilizer. Eye problems. Certain antipsychotics may cause various eye problems. These include blurred vision, a buildup of granular deposits in the cornea and lens. This doesn't usually affect your vision. Oh, that's just wonderful. Just a buildup of granular deposits, but it shouldn't affect your vision. Degeneration of the retina. Glaucoma, which is a serious eye condition. Oculogeric crisis, which affects the muscles that control your eye movements. It can cause your eyes to turn suddenly so you can't control where you look. Heart problems. Okay. Increased heart rate, heart palpitations. Okay, which are heartbeats that suddenly become more noticeable in your chest. Effects of your heart rhythm. This has been known to cause sudden death. Effects of heart rhythm. This has been known to cause sudden death. Liver disorders. Certain antipsychotics may cause liver disorders, jaundice, and yellowing of skin. Metabolic syndrome is the medical name for a combination of the following: weight gain and obesity, high blood sugar, diabetes, high blood pressure, high cholesterol. Okay, taking antipsychotics can increase your risk of developing metabolic syndrome. If you're experiencing diabetes, stroke, heart disease, these might be side effects of, the antipsychotics that your doctor may have prescribed. What you'll find out is a lot of what you don't understand is people will say, listen to your doctor, except when your doctor says something against the drug company. At that point, then your doctor's a quack when he's saying, these drugs are dangerous. Don't listen to your doctor. Then you'll find out, is what a lot of people like to say. But that's not true. Okay? That's not true. When doctors have important things to say about the dangers of drugs, that's when you should listen even more intently. The risk of this increased is even more if you have an unhealthy lifestyle. Your doctors may suggest trying to eat a healthier diet and get enough physical activity can help to reduce this risk. Neuroleptic malignant syndrome. Sweating or fever with a high temperature, tremor, shakiness, rigidity. I had severe rigidity, loss of movement, difficulty speaking and swallowing, rapid heartbeat, very rapid breathing, changes in blood pressure. I've had all that. Changes in consciousness, including confusion and lethargy, stupor. I never had a coma, thank goodness, but the rest I did. So what do they give you? What's the treatment for neuroleptic malignant syndrome? Well, what they say is medication to relax your muscles, medication to counter the chemical effects that are thought to cause blah, blah, blah. What I use, wonderful, electroconvulsive therapy, electroshock treatment, which is kind of like an electrical version of a lobotomy. Now, what did I do to help myself that actually did seem to work? High-dose therapy with magnesium citrate. About 1,600 milligrams of magnesium citrate broken into separate doses. Neuromuscular effects. So, and antipsychotics interfere with the brain chemical dopamine, which is important in controlling movement. Antipsychotics may therefore cause movement disorders. These are most common with first-generation older antipsychotics, and less likely with newer antipsychotics. They include the following: Parkinsonism. Your muscles become stiff and weak. You find it more difficult to make facial expressions. Certain small movements feel difficult, such as writing or picking up objects with your hands. You develop a slow tremor, especially in your hands. Yeah, I had that pretty badly. Your fingers move as if you are rolling a small object between them. When walking, you lean forward, take small steps, and find it difficult to start and stop. Your mouth hangs open and you dribble. Loss of movement. You may find it difficult to move your muscles, may feel very weak. Having little energy to move is also a symptom of depression. So if you experience this, your doctor or psychiatrist may ask if you're feeling depressed. Restlessness. This was a big problem for me, feeling intensely restless and unable to sit still, rock from foot to foot, shuffle your legs, cross or swing your legs repeatedly or continuously, pace up and down, feel emotionally tense and uneasy. Remind you, these are side effects. Does this sound, I don't know, maybe like what people might consider symptoms of mental health disorders, but yet these seem to be being caused by the mental health treatment, the psychotropic treatments. Muscle spasms. Okay. You might find it difficult to speak normally, and people may find it hard to understand you. If a spasm affects the muscles that control your eye movements, it makes your eyes turn suddenly. It may mean you can't control where you look. This is called oculogeric crisis. Sedation, sleepiness, seizures, fits. Many antipsychotics have the potential to cause fits. If you've ever had fits in the past, you should be particularly cautious about taking antipsychotic drugs. Sexual and hormonal problems, acne, increased hair growth across the face and body, osteoporosis, reduced sexual desire, breast development, and the production of breast milk in men. This can affect anyone, including if you were assigned male at birth. So keep that in mind. If you're a dude, you can develop breast development, you can get gynecomastia, and start producing breast milk from these drugs. If you have a vagina, meaning if you're a female, you may experience vaginal dryness, and if you would normally have periods, they might stop, so you might become infertile, or your periods may return, so you could still get pregnant, maybe, so don't have unprotected sex, maybe. Okay, skin problems, allergic rashes. Okay, if you get a rash, you should contact your general practitioner straight away to have it checked. Increased sensitivity to sunlight. It can also cause anaphylaxis. There's a lot of times people can get anaphylaxis from these. A blue-gray discoloration in the skin. Tardive dyskinesia. Okay. Tardive dyskinesia is an effect of certain medications, mainly antipsychotics, and involves experiencing sudden, jerky, or slow twisting movements in your face or body. Tardive psychosis is a term used to describe new psychotic symptoms that begin after you have been taking antipsychotics for a while. Some scientists believe that these symptoms may be caused by your medication. Yes, because they kind of are. Not your original illness. Weight gain. Weight gain is a very... See, this is what's funny. I never had any psychotic symptoms until I was put on an extremely high dose of Seroquel. Okay, over 1,000 milligrams of Seroquel a day. And I started tripping. I mean, to be quite honest, I was tripping. The only thing that I can describe it as would be like, and I've never done any real downers, but it would be like being on heroin, from what I've seen people on heroin. And now I have taken mushrooms. So it would be like I would see shadows that weren't there. The floor would appear to be moving, things like that, because of the medication. Once I stopped the medication, these distortions stopped. Weight gain is a very common side effect, yes. Okay, now moving on. Now I want to quickly talk about nutritional deficiencies in schizophrenia. So schizophrenia is a mental health disorder. Why am I focusing on schizophrenia? Because schizophrenia is one of the main things that Johnson & Johnson, where this board member of Lenape used to work, what they work with, okay? They make antipsychotics. So, schizophrenia is a mental health disorder with significant socioeconomic burden and a complex pathophysiology, as the relationships that potentially link nutrition to the expression of symptoms and the progression of schizophrenia are becoming more apparent. The role of nutrition in schizophrenia management is becoming more important than previously thought. However, despite our current knowledge of possible links between nutrition and schizophrenia and some tentative pathways in this relationship, the larger challenge remains how to get to the point where precision dietary manipulation, blah, blah, blah. Okay, globally, schizophrenia, okay, just rehashing. Mental health disorders have at present become a growing societal concern, with recent data continuing to show the economic... Now, mental health disorders have become a growing societal concern. Could this maybe be because of the side effects of the psychotropic medications? However, in recent years, the inadequacy of so keep this in mind. The inadequacy of conventional therapeutic options and the need for more effective preventative or therapeutic strategies are directing the focus towards examining the possible relationship between nutrition, brain function, and the risk of mental health disorders. The inkling or proof of the concept that nutrition is important in the maintenance of mental health arose from the descriptions of diseases such as pellagra, beriberi, scurvy, phenylketonuria. The pathogenesis of these diseases was linked to nutritional deficiencies and was corrected by nutritional supplementation. So keep that in mind. The pathogenesis of these diseases was linked to nutritional deficiencies and corrected with nutritional supplementation. I highly suggest people learn about the triage theory of aging and disease by Dr. Bruce Ames. Dr. Bruce Ames's triage theory of aging and disease, and subscribe to, if you're not already, to Dr. Rhonda Patrick's channel, Found My Fitness. And also look into the writings of Dr. Joel Wallach. Dr. Joel Wallach he's a veterinarian that became a naturopathic doctor as well. So he has a veterinary degree and a naturopathy degree. And I highly suggest that you read his book, especially Dead Doctors Don't Lie. Okay. Normal development of brain structure and function is dependent to a large extent on the availability of amino acids, lipids, minerals, and vitamins, which are mainly sourced from dietary intake. Hence, there have been suggestions that diet being a modifiable determinant can be targeted for the maintenance of mental health and possibly the management of neuropsychiatric diseases. The emerging yet rapidly evolving field of nutritional psychiatry supports the clinical consideration of dietary modifications or the use of nutritional supplementation in the prevention and/or management of psychiatric disorders. There have been reports demonstrating the relationship between the adoption of healthy dietary practices, diets rich in vegetables, whole grains, fruits, nuts, and fish, and the risk of developing mental health disorders like depression was inversely proportional, meaning the more people followed a generally health-promoting diet that was rich in vegetables, whole grains, fruits, nuts, and fish, it was inversely associating, meaning it was less likely for them to develop these psychiatric conditions. Pathophysiology of understanding. Our understanding of the pathophysiology of schizophrenia had in times past been dependent on the concept that schizophrenia was for a large part a hyper-dopamine, whatever, proposed in the 1960s, blah, 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 yada, 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 dopamine this. Currently, schizophrenia is being described as a complex disorder whose pathophysiology has been attributed to the dysregulation of multiple pathways. What do psychiatric medications cause? Dysregulation of multiple pathways. Deficits in acetylcholine, blah, 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 oxidative stress, inflammation, autoimmunity problems, and genetic issues. The modified dopamine hypothesis has attributed observed in most patients to an increase diet and nutritional factors in schizophrenic pathogenesis. Current evidence from studies on the impact of diet and dietary intake in schizophrenia shows that compared to normal controls, persons with schizophrenia have poor dietary practices characterized by an intake of sodium, an intake of cholesterol, and a higher intake of sodium, a higher intake of cholesterol, a higher intake of saturated fat, and a low fiber intake. Increased consumption of simple sugars and processed foods have also been reported. These poor dietary choices have been suggested as possible causes of obesity, metabolic syndrome, and high mortality figures, which have been associated with schizophrenia. So if you're already following an unhealthy lifestyle and you're lethargic and having mental health symptoms due to this poor lifestyle, and you're thrown a handful of drugs for the symptoms that you have developed, most likely as a result of these poor dietary choices, it is creating a perfect storm for increased psychiatric issues. Diets low in omega-3 fatty acids and low in D vitamin could also increase risk of developing psychosis. The unhealthy dietary practices of persons with schizophrenia have been suggested to result from dysregulation of the reward circuitry mediated by increased dopamine activity. There have been reports suggesting that the incidence of nutritional deficiencies that occur as a result of inadequate intake or poor absorption of nutrients that are critical to the sustenance of human health. Again, please look up Dr. Bruce Ames and the triage theory of aging and disease. Of human health have also been recognized as possible risk factors for the development of psychiatric disorders, including schizophrenia. Also, so keep that in mind, not reaching adequate levels of nutrients that are needed for human sustenance have been recognized as possible risk factors for developing psychiatric disorders. Also, nutrition and nutritional composition of foods have been implicated in mental health. Earlier reports had shown that increased intake of foods deficient in critical compounds, such as essential fatty acids, or rich in substances that can elicit an autoimmune reaction, such as gluten, could be linked to the development of brain diseases, and more recently mental illnesses, including schizophrenia. Schizophrenia has also been associated with the development of nutritional deficiencies and metabolic disorders. The results of clinical studies and systematic reviews have demonstrated a higher incidence of metabolic syndrome in patients with schizophrenia compared to the general population. This has been attributed in part to poor eating habits and possibly side effects of pharmacotherapy. So it is literally attributed to pharmacotherapy, meaning the use of pharmaceuticals. For what? The treatment of psychosis. High homocysteine levels as well as low levels of vitamins B9, B12, C, and E. Now, low levels of B9 and B12 can cause raised homocysteine. Vitamin C and vitamin E are antioxidant nutrients. So low levels of vitamin C and vitamin E in the blood of newly diagnosed patients and patients with long-term schizophrenia. Decreased brain levels of vitamin B12 have also been reported in schizophrenia deficiencies, and vitamin D have also been implicated in schizophrenia, and developmental deficiencies of D3 has been associated with an increased risk of developing schizophrenia in adulthood. There have also been suggestions that low maternal vitamin D levels do not constitute a continuous risk factor for the development of schizophrenia. However, below a critical threshold, it could be an association, could be associated with an increased risk of developing schizophrenia. So it might not be an ongoing issue, but it could be at first an issue. Deficiencies or excesses of essential trace elements including calcium, zinc, selenium, copper, manganese have also been observed in persons with schizophrenia. Mechanisms which diet, nutrient and or nutritional deficiencies cause schizophrenia or worsen its severity are still being studied. However, a number of modalities have been suggested. These include factors like poor diet, poor dietary practices, and or nutritional deficiencies that have been linked with the development of hyperhomocysteemia, the gut microbiota, blah, 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 blah. Deficiencies or low levels of antioxidant vitamins such as C and E and beta-carotene have been reported to cause oxidative stress. There is overwhelming evidence demonstrating the crucial role played by oxidative stress in the pathophysiology of schizophrenia. There is overwhelming evidence demonstrating the crucial role played by oxidative stress in the pathophysiology of schizophrenia. One more time. There is overwhelming evidence demonstrating the crucial role played by oxidative stress in the pathophysiology of schizophrenia. What I would like to say to this is you should read up on the topic of orthomolecular psychiatry. You should read up on the findings, the clinical findings of Dr. Abraham Hoffer, okay, and the treatment of schizophrenia with niacin and vitamin C. Higher lipid peroxidation levels, alterations in plasma and brain levels of antioxidants and or antioxidant enzyme activity have also been observed in persons with schizophrenia. Oxidative stress has been described as a possible link between vitamin deficiencies and schizophrenia. Studies have also shown that antioxidant vitamins such as C and E offer protection against cellular damage due to either inflammation or highly reactive oxygen species. Nutrition and schizophrenia therapy, blah, blah, blah. Orthomolecular medicine is defined as the restoration and maintenance of health through the administration of adequate amounts of substances normally occurring in the body. So what is orthomolecular medicine or orthomolecular psychiatry? Orthomolecular medicine is defined as the restoration and maintenance of health through administration of adequate amounts of substances normally occurring in the body. Orthomolecular medicine is defined as the restoration and maintenance of health through the administration of adequate amounts of substances normally occurring in the body. Read up on the works of Dr. Abraham Hoffer. Read up on the works of Dr. Linus Pauling. Read up on the works of Dr. Joel Wallach. Read up on the works of Dr. Robert C. Atkins. It allows the use of endogenous and natural compounds as either supplement in conditions of nutritional deficiencies or in the provision of additional requirements in conditions with increased demand. Although in the past it had been regarded as a non-scientific approach to healing, the availability of increasing scientific evidence supporting its benefits in aging-related diseases. Okay, so there is, of course, increasing scientific evidence supporting the benefits of orthomolecular medicine in age-related diseases. Again, increasing scientific evidence supporting orthomolecular medicine for the treatment of age-related diseases. More recently, in the management of a number of neuropsychiatric disorders, including depression and schizophrenia, is redefining the importance of orthomolecular medicine in clinical medicine. Dietary intervention as a therapeutic target in schizophrenia. In the last half-century, modifying dietary behaviors for prevention and management of chronic disease has been a crucial area of research. More recently, benefits of dietary choices and nutritional factors in sustaining mental health, especially in preventing the development of medical and metabolic complications, are generally being recognized in psychiatry. Also, use of dietary interventions, particularly in the management of schizophrenia, is slowly evolving. Healthy diets, such as the dietary approaches to stop hypertension, the DASH diet, the Mediterranean diet, or lifestyle changes or dietary modifications, have been shown to be beneficial in the prevention and risk factor reduction and management of chronic diseases. Several studies have demonstrated that strict adherence to these dietary choices have rewarding effects on diabetes, cardiovascular diseases, obstructive sleep apnea, chronic kidney disease, arthritis, cancer, and metabolic diseases, with significant impact in reducing total mortality. The Mediterranean diet, which reflects the eating habits of the Mediterranean or Middle Eastern countries, is based on the consumption of fresh fruits, fresh vegetables, cereals, olive oil, and plants, with low consumption of meat. While the DASH diet was designed by the National Institute of Health, funded researchers in the 1990s to aid in the prevention and treatment of high blood pressure, was also shown effective in lowering blood cholesterol levels, blah, blah, blah. It is a diet rich in vegetables, fruits, blah, blah, blah. The benefits of good nutrition in schizophrenia have been self-reported. Diet and nutritional supplements as therapeutic agents, I'm going to get more into that later anyway. Ketogenic diets are high in fat but low in carbohydrates and have been shown to be successful weight loss and or control and reduction. I'm going to get more into that later. Okay, moving on. Okay, then. Vitamins and supplements that may be helpful with schizophrenia. Omega-3 fatty acids. You can read this in depth on your own. Vitamin D. This is from WebMD, of course. So read this in depth on your own. So you have omega-3 fatty acids, vitamin D. B vitamins. A large review of 800 patients found that people who took high-dose B vitamins like B6, B8, and B12, in addition to their medication, significantly reduced symptoms of schizophrenia compared with those who took medication alone. Vitamin E, probiotics, melatonin, and moving on. Supplementation of vitamin C with atypical antipsychotics reduces oxidative stress and improves the outcome of schizophrenia. Oral supplementation of vitamin C with atypical antipsychotic reverses ascorbic acid levels, reduces oxidative stress, and improves basically the psychiatric condition of the patient. Hence, both the drugs in combination can be used in the treatment of schizophrenia. They're referring to vitamin C as a drug there, just so you're aware. Folate and vitamin B12 backed to help battle schizophrenia symptoms. So, yeah, new study finds that adding folate and vitamin B12 to standard antipsychotic treatment regime led to significant improvements in symptomatic components of schizophrenia, including apathy, social withdrawal, and lack of emotional expressiveness. Now, I wonder what the research would say if they didn't use the antipsychotics and just used the folate and the B12. So Dr. Abraham Hoffer is famous for treating schizophrenia with niacin and vitamin C. Niacin is so good at treating vitamin C, there's actually a subset of schizophrenia called niacin-respondent subset of schizophrenia. Okay, so it is well known that niacin deficiency manifests with several psychiatric manifestations. Well known that niacin deficiency manifests with several psychiatric manifestations. Okay? So they propose a model that a subset of schizophrenia can respond to niacin augmentation therapy better than other subsets. You can read this on your own if you'd like. Moving on. Efficacy of high-dose glycine in the treatment of enduring negative symptoms of schizophrenia. Glycine treatment was well tolerated and induced increased glycine, blah, blah, blah. Conclusion, these findings support hypoglutamateric hypothesis of schizophrenia and suggest a novel approach for pharmacotherapy of negative symptoms associated with this illness. So glycine, administration of an amino acid, glycine, helps to improve the symptoms of schizophrenia. The influence of quercetin on recognition, memory, and brain oxidative damage in a ketamine model of schizophrenia. So this is when ketamine has been used to induce schizophrenia. So you have to understand this. Ketamine was used to induce schizophrenia. Ketamine is one of the many psychedelic substances and street drugs that is being looked into by drug companies to treat mental health disorders. Keep that in mind. This is a street drug that literally causes schizophrenia that's being looked into. It's being looked into as a psychiatric treatment. But the conclusion is these results show that quercetin has the potential to improve cognitive deficits in mice, and that quercetin may be useful for treating symptoms of schizophrenia, partially due to its ability to scavenge free radicals and its high antioxidant capacity. People know I loves me some quercetin. So a flavonoid on the brain, quercetin is a potential therapeutic agent in central nervous system disorders. Okay, so quercetin has long been thought to be a neurodegenerative disease, but let's see about quercetin in neurodegenerative diseases such as Alzheimer's, Parkinson's, and Huntington's disease, dementia and Alzheimer's disease. You can read this on your own. I've already gone over this in a past thing. It has a cholinergic effect, so it helps with choline, keeping choline in the brain and whatnot. So pro-neurotrophic effect, anti-inflammatory effect. This is the way it works. Antioxidant effect, anti-neurotoxic effect, and it helps get rid of protein aggregates. Improving metabolic disruption. Remember, metabolic disorder is caused by psychiatric medications. It helps with Parkinson's disease, helps with Huntington's disease, and other neurodegenerative diseases. Quercetin was also investigated in single studies on models of multiple sclerosis, blah, 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 ALS, which is Lou Gehrig's disease. Depressive disorders it helps with. Anxiety disorders. It works with synergy. And yeah, you can read this on your own when you get a chance. So what are the dietary patterns of people with schizophrenia? Of course, they're not very good. So conclusion, the serial dietary pattern is associated with schizophrenia. Schizophrenia is a severe mental illness, yada yada, everybody. Diet has been considered as a variable factor of the pathogenesis of schizophrenia. Previous studies, now this is what's funny, when you go to a psychiatrist, what don't they say? They don't say, hey, let's change your diet, and here's a handful of supplements, or at least even just a multivitamin that you can take, and we'll see if your symptoms improve after we change your diet and give you this multivitamin. You never hear that. What they do is they go, here's a handful of drugs that we're going to try and see if it works. Now, alteration of diet and a multivitamin are much less likely to have the side effects that the drugs do, but that's never tried, although it seems to have a lot of evidence behind the fact that it probably would work. Consider the fact that nutrient deficiencies have been linked to numerous psychiatric disorders, but yet psychiatrists are not operating to correct any nutrient deficiencies. Nutrients are consumed as a mixture in the diet, yada, 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 participants, blah, 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 measurements, yada, yada, yada. The demographic distribution of the participants, yada, the number 2, okay. Okay, the serial dietary pattern was positively associated with schizophrenia, meaning it shows that people that eat this way have higher incidence of schizophrenia. So this is a diet that was, the association with the intake of proteins, fats, saturated fatty acids, monounsaturated fatty acids, polyunsaturated. The odds ratio for schizophrenia according to discussion. Designed to cross-section. The vegetable dietary pattern was characterized by high consumption of green leafy vegetables. So what you're seeing here is you're going to see a diet very similar to the diet. This is very similar to an Atkins diet or a zone diet or a Wahls protocol. The vegetable dietary pattern was characterized by a high consumption of green leafy vegetables, seaweed, potatoes, and soybean products. Very, very, very similar to an Okinawan diet. Soy products such as tofu and natto, and positively correlated with the intakes of fats and proteins. A previous study demonstrated a relationship between fatty acids and schizophrenia. Therefore, they hypothesized that the dietary pattern consuming a large quantity of vegetables would be associated with a lower risk of schizophrenia morbidities. However, an apparent association was not observed between the vegetable dietary pattern and schizophrenia. By contrast, the cereal dietary pattern, which is characterized by a high consumption of rice, breads, confections, was associated with schizophrenia. Okay, previous studies have demonstrated that a relationship between polyunsaturated blah blah blah, sudden change blah, blah, blah. A few studies among blah 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 blah. Conclusion. They hypothesized that the dietary pattern comprising high amounts of vegetables would be associated with lower risk of schizophrenia. High amounts of vegetables was associated with a lower risk of schizophrenia. However, no evident association was observed between the vegetable dietary pattern and schizophrenia. So they didn't observe that this lowered the risk of schizophrenia. However, the cereal diet pattern, which was characterized by a high consumption of rice, bread, and confectionaries, well, I think the important thing there is confectionaries, was positively correlated with the intake of fats and protein, blah, blah, blah. So that was correlated with a higher risk of schizophrenia. So let's move on. So what are Axis 1 disorders? Okay, Axis 1 disorders are major depressive disorder, bipolar disorder, schizophrenia, generalized anxiety disorder, panic disorder, post-traumatic stress disorder, obsessive compulsive disorder, substance use disorder. Axis 2 included the 10 personality disorders, yada, yada, yada. And moving on. Mediterranean diet versus schizophrenia here. Let's see. So this is the introduction, blah, blah, blah. A significant protective effect between the Mediterranean diet and Axis 1 disorders was shown through this meta-analysis. The 15 cohort studies, blah, blah, blah. Out of the 15 cohort studies, 14 studies examined the relationship between the Mediterranean diet and depression. The one study examined the relationship between this diet and eating disorders, blah, blah, blah. Out of the 19 cross-sectional studies, 9 studies examined, blah, blah, blah. Let's get to the conclusion here. Results of the quality of discussion. Considering the high prevalence of mental health disorders in modern societies, applying strategies to prevent serious psychological problems is crucial. Diets such as the Mediterranean diet may help to control the progression of mental disorders. Diets such as the Mediterranean diet may help to control the progression of mental disorders. As a result, a systemic review was conducted to determine the relationship between the Mediterranean diet and Axis 1 disorders. A careful review of observational studies conducted in this area showed that the Mediterranean diet can be effective. So it showed the Mediterranean diet can be effective in controlling or preventing Axis 1 disorders. Overall, out of the 36 studies included in this review, most of them, 25 studies, blah, 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 reported significant protective association. The Mediterranean diet can have protective effects on mental health due to the presence of B vitamins. This diet increases the body's antioxidant capacity by having plant-based components rich in vitamins, flavonoids, minerals, and phenylytic compounds. So phytonutrients, vitamins, and minerals. Oxidative stress, of course, leads to increased inflammatory status through the activation of transcription factors, blah, blah, blah. ADHD, blah, 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 blah. Among the strengths of the study are the novelty, blah, blah, blah. Conclusion. It seems that the Mediterranean diet can be a practical diet in the control of Axis I disorders. Also, the Mediterranean diet is not an extreme diet. So, why is this not a first line? Why aren't psychiatrists saying, how about you try out this mild diet that's not really that crazy? And you will see, I will get to more aggressive dietary approaches as I go on, going on to the ketogenic diet, for example. But this is the least aggressive dietary pattern that seems to be extremely protective in the extremely protective and work as a treatment. Now imagine if you use this combined with aggressive supplementation. But psychiatrists aren't doing that. They're just giving you a handful of drugs. But there's evidence showing that this does have a great effect in protection and in treatment of Axis I disorders. What is the best diet for mood? What are you feeding this dog? Blah, 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 blah. Okay, so if you have a dog that is not feeling well, when you bring the dog to a veterinarian, what is the first thing the vet asks? What are you feeding this dog? This is, and again, why don't you read Dead Doctors Don't Lie by Joel Wallach, and he can explain the difference between veterinary medicine, which actually understands nutrition, and human medicine, which is very deficient in understanding nutrition. Although a tenet virtually ignored by modern medicine until very recently, it stands to reason that what you eat is going to affect your body in a substantial way. This is no truer than when it comes to mental health. Poor diet will increase the likelihood of any disease. Healthy dietary choices for the best mood. More and more studies are showing that healthy foods can prevent both anxiety and depression and block the ravages on the body that occurs with mental illness. One landmark five-year study out of Spain looked at the lives and eating patterns of 10,000 people. What they found was those people who followed a Mediterranean diet were 50% less likely to develop anxiety or depression. The study specifically found that intakes of fruits, nuts, beans, and olive oil supported mood. So specifically, fruits, nuts, beans, and olive oil supported a good mood. Other studies regarding the Mediterranean diet have shown that the endothelial linings, the inner lining of the blood vessels of these subjects, were much healthier and predisposed them to lower rates of cardiovascular disease. So this helps to reduce the rate of cardiovascular disease. Components of the Mediterranean diet: high amounts of monounsaturated fat and low amounts of saturated fat. So you're going to be eating a lot of olive oil and nuts and seeds, and you're not going to be eating a lot of meat on this diet, or a lot of cheese on this diet, or a lot of full-fat dairy. High intake of legumes, high fish intake, high intake of whole grain cereals and breads, high intake of fruits and nuts, high intake of vegetables. I would remove alcohol. You're not getting much benefit from the alcohol, especially if you have a psychiatric issue. Moderate intake of milk and dairy products. Moderate, not high, moderate. Low intake of meat and meat products. A recent cross-sectional study from the Canadian Journal of Psychiatry looked closely at foods and nutrient intakes of 97 people with confirmed mood disorders. Researchers looked at the intake of fats, carbohydrates, and proteins, as well as vitamins and minerals. They evaluated these patients using a global assessment functioning GAF score, blah, 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 da-da-da. These scales are the most good, da-da-da. Okay, also correlated were intakes of linoleic acid, which is an omega-6 fatty acid, which we will discuss in blah, blah, blah. Okay, riboflavin, niacin, folic acid, B6, and B12, pantothenic acid, calcium, phosphorus, potassium, and iron, as well as magnesium and zinc. The study showed higher levels of mental function were associated with higher intake of nutrients. Again, learn about Dr. Bruce Ames. Learn about the triage theory of aging and disease. Which diet is really the best? Oftentimes patients blah 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 blah. So create an individualized diet. But if I did not know anything about an individual or blah blah blah, I would probably recommend the Mediterranean diet. Okay, moving on. Ketogenic therapy and serious mental illness. Now, what you have to keep in mind, people will go, oh, well, ketogenic therapy for mental illness. The ketogenic diet was developed by a diabetologist/endocrinologist for the treatment of seizures. Okay? Things that work for seizures seem to work for mental illness. Ketogenic diet is no different. So, it's typically a high-fat, moderate protein, very low carbohydrate diet. Blah, blah, blah. Blah, 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 blah. So in the first case studies, 2 patients with long-standing treatment-resistant schizoaffective disorder started a ketogenic diet for weight loss. Within 2 months of starting the diet, both patients experienced significant reductions in psychotic symptoms. As measured by the positive-negative symptom scale, both patients either purposely or inadvertently stopped the ketogenic diet, and their psychotic symptoms returned quickly. Improvements in psychotic symptoms of both patients lost significant accounts of weight, blah, 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 blah. 2 additional case studies highlight the long-term potential of ketogenic diet as a sustainable treatment that can induce full remission. Ketogenic diet as a sustainable treatment that can induce full remission of psychotic symptoms in some people. So maybe if somebody's not responding necessarily to the Mediterranean diet, maybe it just isn't, they're taking the supplements with the Mediterranean diet, ain't doing what it should be doing, well, maybe then you go to a ketogenic diet and see what that does. The impact of the Swank and Walls elimination dietary interventions on fatigue, quality of life, and relapsing remitting multiple sclerosis. Participants completed 12 weeks. Conclusion, both diets, these are 2 diets for the treatment of multiple sclerosis. Both diets were associated with clinically meaningful within group reductions in fatigue and improvement, blah, blah, blah. You didn't think I was only going to talk about diet, did you? Because remember, like Jack LaLanne says, and please do read Jack LaLanne's books, especially Revitalize Your Life, but like Jack LaLanne says, exercise is king, nutrition is queen, put them together and you got a kingdom. So resistance training in patients with schizophrenia. Okay. So, it was observed significant positive effects on the level of functioning assessed by the GAF score, with the intervention group. Findings indicate that patients with schizophrenia could safely participate in resistance training with relevant improvements in their level of functioning. So, schizophrenic patients could safely participate in resistance training with improvements in their overall functioning as rated by the GAF score. So why not focus on diet, supplementation, and fitness? Now, I'm into anti-aging, so I research a lot on different physical therapies. One of the physical therapies is respiratory therapy, because you have to treat each system of the body. You have to reverse the age of every system of the body. So the effect of diaphragmatic breathing on attention, negative effect, and stress in healthy adults. Obviously, read this article in depth. This is getting a little longer, but the present study illustrates the potential for diaphragmatic breathing practice to improve. See, the thing is, you don't necessarily have to focus only on strength training. What about diaphragmatic breathing, respiratory therapy? Okay, because this present study illustrates the potential for diaphragmatic breathing practice to improve cognitive performance and reduce negative subjective and physiological consequences of stress in healthy adults, despite the promise of diaphragmatic breathing practice in supporting function and health. Further investigation is, of course, needed. But look, so this is a very good study. It covers the limitations of the study, of course. Very solid study. Breathing practice and physiological responses. Breathing practice and enhanced sustained attention. Breathing practice to decrease negative effect. That's about the emotional effects. Okay, the effectiveness of breathing practice. Discussion. Salivary cortisol. So it reduces cortisol, sustained attention, positive and negative effect, respiration rate, results. And this is important. You have to understand the neurological and endocrine systems are highly connected to one another, in the sense that the nervous system kind of tells the endocrine system what to release and how much of it to release to get what effects. Okay, cortisol, adrenaline, these are highly detrimental substances when released in an overabundance. Demographic characteristics, blah, 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 yada, yada. So you see, this is a very well-performed study. I highly recommend people read it. And I think I'm going to call it quits for this video. I think that's all for this video. But remember, well, no, I'm not, because I want to show you. I mean, clearly the facts are the facts here. You should not have retired National Policy and Advocacy Director for Mental Health at Johnson & Johnson on the board of directors, which regulates the policy of Lenape Valley Foundation, who prescribes the drugs that are manufactured by Johnson & Johnson. And that's all for this video.